Welcome to a Prevent Connect podcast, where we explore the prevention of violence against women. This is a project of the California Coalition Against Sexual Assault.
Okay. We'll have more time, a lot more time for interaction at your small tables. So I'm going to go ahead and bring us back to the full group and just give you an overview of what we're going to do today between now and 5. So the workshop description and the objectives should be in your, what is this called? Conference program, thank you. And our plan is basically to move through those objectives in order that they're listed, and we're going to talk about, why we might go about capacity building and planning to address multiple forms of violence in an interconnected way. Then Alex is going to talk about Contra Costa County's journey to expand their focus and impact to prevent multiple forms of violence and abuse through a multidisciplinary alliance. And then I'm going to talk about some work that we've done to describe 5 strategies to leverage connections between multiple forms of violence for a coherent and powerful prevention plan, and give some examples from different communities that we've worked with. And then we'll have time for discussion so that you can explore how the themes and lessons from other communities might apply to your own community planning processes. So that's what we're about to do. So let's start with just taking a few minutes to do some Q&A. We're interested in hearing what questions you have, questions about why you might want to do capacity building and planning to address multiple forms of violence, or what is involved, or how to go about it. So let's go ahead and just hear from some of the tables throughout the room to hear what are some of the questions that you are bringing to this session. And we'll have a mic runner who is able to go to you to be able to make sure that everyone can hear, and we have a hand in the background. Thank you so much.
Hi. So I work for a rape crisis center, and I actually just started this group of preventionists trying to kind of start like a you know what I'm trying to say. And I was trying to start that thing. And I guess one question I kind of have is how to incentivize the other organizations and partnerships to want to, I guess, add more work to their load in order to complete that the thing. So yeah, that's my question, is like how to incentivize them to want to do the things. Thank you.
Great. How to incentivize a shared, more collective approach so that folks want to collaborate across forms of violence and abuse. It's a great question. Yes. Here, hold on a second. I want to make sure that we all use the mic, so.
Oh, sorry.
She chose the hand.
I just saw that.
Oh, sorry about that.
You can go first, though. Oh. This is weird. I'm from Indiana, and I've been working at the state level to bring multiple forms of violence to work together, and we're kind of at the point now where I guess my question is, how do we agree what to work on, or who works on what, or what the vision or what the goals are for a collective, collaborative group?
It seems like one of the barriers sometimes to doing this is that the way funding streams work, they're very specific to particular disciplines, and so how do you address both trying to get funders to be more flexible in this, and also folks that are funded by multiple different mechanisms to join together?
Right here.
I would like you to address how do you foster a truly collaborative approach when you have partners with disequal power?
Could you say that one more time?
How do you foster a truly collaborative approach when you have participants with disequal primary political power?
Disequal political power. Thank you. That's a great question.
I'll come back here next.
One of the things that I'm really interested in is to see how the, Contra Costa was successful in being able to identify and address all different forms and intersections of violence, because I think that's something that we really struggle with, because people come in with very specific agendas of a focus on domestic violence or child abuse, sexual assault. So to see a county being able to do that, to bring all those intersections together, is really interesting.
so we'll have to cut you off.
Hi, I'm from Maine. I work at the statewide coalition for sexual assault. We just had a state study done to decide if we should combine our SV and DV services, and it was determined that it was not in the best interest to do that. But then now working to go back and do this collaborative process of like, we don't actually need to merge, but we do want to work together. So trying to kind of navigate those interesting waters.
Yes, what's linked and what's distinct.
I'd be interested in hearing, I work at a rural shelter in Canada, and we offer DV and sexual violence services, and there's nothing else. So basically all violence comes to us. So I'd be interested in hearing people's experiences of maintaining professionalism and expertise in fields while still serving populations, and what's just care and what's just enough care.
My name is Dontavius Seals. I'm in the military station out of Hawaii. But one thing I'll be interested in seeing is military residents, members, although we're federal employees, we're based in different states. Collaborative efforts working with them and using some of our federal funding to relieve some of your financial hardships, because we don't all stay on the military installation. We do stay out in society amongst regular citizens.
Okay, those are great questions, and we've written them down. Thank you, Alex. And I think we'll probably touch on some of them as we go through our presentations, and then we'll come back to them if we haven't. But I just had a moment where I wanted to spend a day with all of you. You know, we could get into different cohorts, folks working on similar issues and that sort of thing. So we won't quite be able to do that, which is a missed opportunity, but it's great to have this time together, and I'm sure the connections will continue after. So I'm going to turn it over to Alex, who's going to tell her story of the Contra Costa County journey.
Yeah, great. Thank you all for being here. Those are really good questions. I'm hoping we will address most of them, like Lisa said today, but we'll make sure that there's time at the end if for some reason we haven't addressed one of those questions, so that we can bring that back up and have that discussion. So like I said earlier, my name is Alex Madsen. I'm with the Alliance to End Abuse. I describe our office as essentially the Violence Prevention and Intervention Office of Contra Costa County. So if you were to take OVW on the federal level and minimize it until it was very small and put it in a county government, that's essentially what our office is. So our main focus areas are domestic violence, sexual assault, human trafficking, and then we have a strong kind of overlap with elder abuse and child abuse. So for those of you who don't know where Contra Costa County is, you're probably sitting here being like, cool, can you clue me in? So Contra Costa County is in Northern California. We are kind of just north and a little bit east of Oakland. So if you're familiar with Oakland, Alameda County, that area, that's where we are. From San Francisco, we are on the East Bay, as they call it, and we're just above, again, kind of Alameda County, that zone. Our county is big. We have over 800 square miles. It's huge. We have a very interesting shape to our county, so we have a very clear distinction between West County and East County. We have a big rural population. We have a lot of farming on the east side of our county, so a lot of agriculture. And then we have a couple relatively big cities. So some of you might have heard of Richmond, California. That is in our county. That's on the west side of our county. Concord, California is also the central part of our county. Those are kind of two of the bigger cities. Antioch, Pittsburgh are the other ones on the east side of the county that you might have heard of as well. In terms of our county population, we have a little bit over 1 million residents. Okay, so it's huge. All of that to kind of just ground you in the fact that that's where all of this is taking place. So it's a relatively big, relatively diverse county. So I want to share just a little bit with you about kind of the origin story of our office and how we came to be. Just to kind of ground you in how long we've been around. So in the late 1990s, there was a group of folks. It initiated out of our domestic violence shelter, our local domestic violence shelter, essentially was kind of the organizing body and said, hey, there's a lot of different responses to domestic violence in our county, and it's really not working. Depends on which jurisdiction you're in, you're gonna get treated really differently. There's not a lot of coordination, so we all well know, right, that folks don't necessarily stay in the same city or same area. So folks are moving throughout the county and being treated very differently depending on where they're moving. So our local domestic violence agency rallied a bunch of other agencies and local government agencies as well, and said, hey, we need to do something about this. Went to the Board of Supervisors in our county and said, we need a coordinating agency. We need someone who's literally going to see the entire big picture of the county, look at kind of the systems level stuff that's happening, and do a little bit more coordination and collaboration. So in 2000, the Board of Supervisors said, great, that's a great idea. They convened about 50 leaders from across Contra Costa County from all different sectors. So we had law enforcement, district attorney, public defender, we had child welfare there, public health, and then we had a lot of CBOs and nonprofits. So we had housing, shelter, we had DV agency, rape crisis center, right, all the different services and CBOs that we have in our community. Met and basically said, what would this office look like? What would this program look like if we were to create it? And essentially they said, you know, it probably should be a government agency that potentially could get long-term sustainable funding, and that would literally just act as a convener, right? Convening this group, you know, essentially originally it was going to be those 50 folks that came together in 2000, to come together on a regular basis and just talk about what's working, what's not working, and can we eventually develop some systems, some protocols, some policies that could be rolled out across the county, or at least upheld as a best practice, right, and encouraged. So as this group was convening, one of the things that this group did was talk to local legislators and say, hey, we have this idea to create this pilot program or this pilot office. We need funding for it. We can't just, you know, come up with the funding. So at the time, it was Senator Torlakson. Some of you maybe know him. He kind of jumped on this idea and said, great, let's put this in the legislation. So he championed a bill that eventually became law. And in 2001, SB 425 was passed in the state of California. And that legislation essentially said, we're going to allow Contra Costa County to be a pilot program to essentially act as a coordinating agency to improve system-wide response, specifically to domestic violence. So that legislation passed, and what that essentially did, how the funding came to be, is that legislation says that there's going to be a small fee attached to marriage certificates, birth certificates, and death certificates. So anytime in our county you go and ask for a copy of one of those certificates, there's a small little fee attached to it. It originally started at about $1.50. It's now increased, I believe, to $2. That fund goes directly to our office, right? So when SB 425 passed, this was just a pilot. It said, we're just going to pilot this program and see if it works, okay? See how successful we are. So it was piloted for about 2 years. After 2 years, there was an evaluation process that went through. Excuse me, I'm going to plug in my computer to make sure it doesn't die. There was a series of evaluations that happened and essentially said, you know, we don't have all the data yet, but this is a relatively successful initiative. So when all that evaluation data came out, there was a push to create sustainable funding. So in 2006, let me just finish and then I'll answer your question. In 2006, SB 968 was passed, which essentially said, yes, we're still going to keep those fees. That funding is going to still come from the marriage, birth, and death certificate, but we want to create some sustainable ongoing funding as well. So this essentially said that we are going to attach some fees to several other records information that you grab, as well as the Board of Supervisors, when this legislation passed, said we are always going to have a chunk of funding that comes from our Board of Supervisors that's going to go to this initiative. Yes?
You looked at data. What data elements or data points did you look at to determine that it had been successful?
This is like the $9 million question. Yes. And we're still figuring this out, right? Like we continually, and we'll talk about this a little bit later, one of the continual challenges for an initiative like this is how do you measure impact, right? Because it is so soft. So one of the things that they measured was amount of connections created, so relationship building. So through this initiative, have you met someone new? Have you built a relationship with someone at a different agency? And if so, who was that and how? The other thing that they measured are new protocols or policies created. So was there a new protocol or policy created internally within your agency, whatever agency that is addressing domestic violence? Are you responding to domestic violence differently? It was mostly done through surveys and interview groups. Okay, so there wasn't a lot of hard data attached to it. Yeah, great question. And we're still in the process of figuring that out, and we'll talk about that a little bit later. So, 2006, we're essentially established as ongoing, going to be a permanent office. At that point, the Board of Supervisors said we need to figure out where you're going to live in terms of the county. we were put within the Employment and Human Services Department. So for those of you who are familiar with how local and national government works, large department, they felt like that was the best fit for us. We think it's probably an okay fit, but it's a little confusing in terms of where we should be in terms of the government structure. So that's where we continue to sit. In around 2009, we got our first grant from the Office of Refugees and Resettlement, and it was, sorry, not our first grant, our first human trafficking grant. We'd had domestic violence grants before that. And it was in 2009 when we realized, like someone just very eloquently said earlier, right? We're not just talking about domestic violence, right? When we're talking about domestic violence, we're talking about all forms of other forms of violence. And one of the ones that was coming up a lot was human trafficking and sexual assault. So in 2009, when we got that ORR grant that focused specifically on human trafficking, we very intentionally said, okay, this initiative isn't just about domestic violence, it's also about human trafficking and sexual assault. Shortly after, in 2009, we also got a sexual assault grant. And then, in 2016, we had a name change. So you'll notice everything here has been branded as the Alliance to End Abuse. That's our current name. So that name came in 2016. In 2001, when we were kind of first created, the name of our office was the Zero Tolerance for Domestic Violence Initiative, right? There's a lot of issues with that name. And we really struggled with that name for about the last 6-7 years. And it took a really long time. Because we are a Board of Supervisors initiative, anything that we do has to run all the way through them. So it took a really long time to convince them that zero tolerance is not something that we want in our name. And second of all, that we got to get domestic violence out of our name, because we're not just talking about domestic violence anymore, right? We're very clearly talking about all forms of violence. Okay, so that's a very long origin story. That's how we came to be. So since about 2009, we've been focusing on those mainly 3 forms of violence. 2016, we officially become the Alliance to End Abuse. So I just put that up here just to show you that this was our original poster back in 2000. So it says Zero Tolerance for Domestic Violence. You can't read this at the bottom, but I just want to read it to you so you know what it says there. It says, you are helping. It says $1.50 of what you pay for birth, death, and marriage records helps increase the safety and security of domestic violence victims. Get help for children exposed to violence. Hold those that abuse more accountable through prosecution and intervention services. And reduce violence and abuse directed at elders. So that's what it says kind of here in this pink thing, and then you'll see our Zero Tolerance logo. So that was kind of just our first rollout of, here's what we are. So here's our goal, our mission. It's long and wordy. I'll read it, and then I'll kind of give you my little spiel on it. So it says, our mission is to reduce and prevent interpersonal violence in Contra Costa County by fostering the development and implementation of collaborative, coordinated, and integrative services, supports, interventions, and prevention activities. It's really long-worded, and anyone who reads that is going to be like, what the hell does that mean? I went to a session earlier today about communications and how important it is to put our mission statement and other things in very plain, clear language. This is an example of what not to be sharing with people, right? Because you read that and you're like, I don't know what that means. So we often describe ourselves as a systems change initiative, which is also very soft. It's hard to clearly articulate what a systems change initiative is, and you'll also have heard me say we're the violence prevention or intervention office, which is maybe a little bit more concrete, but not that concrete. So when we talk specifically about, okay, so what do you do? I talk about our 3 strategies and then give clear examples of projects. So our 3 strategies, the first one is strengthening systems. So this is pretty straightforward. We are going to work with your agency, regardless of whether you're public or private, to apply a violence prevention lens to the work that you do. So another ways of describing this is technical assistance, right? We are going to show up at your agency to help you and support you in developing protocols and policies, in figuring out what training your staff might need, in sharing best practices, essentially, okay? The other thing that goes with strengthening systems is piloting projects. So sometimes I like to think of our office as an incubator. So we take on new, innovative best practices. We try and get funding for them, and then we pilot them, right? And usually we'll pilot them for a couple years, and then the hope is, and most of the time, they go off and be their own thing. They don't live with our office. So that's another thing that falls under strengthening systems. Building partnerships, also relatively straightforward, but really this is about facilitating open sharing of resources, right? We tend to do this thing where we hold on to our resources, we silo them, and sometimes we don't even do that intentionally. It's just what happens. So our job, because we're going out and talking to all these different agencies, is to say, oh my gosh, you should talk to these people because they have this really awesome tool that you're using, and let me go talk to that person and grab that tool and bring it back to your agency for you, right? So we do that kind of legwork in terms of connecting the dots. And then the last one on there, educating professionals in the community. So we do a lot of professional development trainings, we host a lot of workshops. Our staff will go out and do trainings, but we also will bring people in and then invite partners to different trainings. So I'm going to share our projects in a moment, but first I want to talk a little bit about this core project team. So you'll remember way back in 2000 when we had that first convening of leaders in the community to talk about what kind of initiative or office is needed. That was kind of basically the first meeting of what we now call our core project team. So core project team is sometimes hard to describe to folks because it doesn't fit any model. But we still have a core project team, and I would essentially describe them as an advisory group, right, or a steering committee. Some people might say kind of like a board of directors, but we're not a nonprofit, so it's not quite like a board of directors. And some of these folks are funded through us, right? So it's a little complicated. But I just wanted to put some of these folks up here just so you know who some of the kind of key partners are that sit at the table in terms of directing what best practices look like, in terms of directing what protocols and policies we should be pushing. You'll notice a lot of the partners that I mentioned at the beginning. Some ones that I haven't mentioned yet: Office of Education, Health Services, Superior Courts, local Superior Courts, Family Justice Center, which I think many of you probably have in your agencies, in your areas. Bay Area Legal Aid, we also have some law enforcement agencies that are at that table. This core project team is continually evolving. So again, a lot of these folks have been here since the very beginning of the Alliance. This team continues to evolve based on who has time, who has capacity, and also who we feel like needs to show up at the table. So in the last couple years, one of the groups that we've really been wanting to connect with and reach out to is public health, and we'll hear a little bit about them later on. So there's been a really strong initiative from this group of folks to get public health to the table, right? And they just joined. I mentioned a little bit ago that some of these folks are funded. So one of the things that my office also does is act as a funder. So we will apply for grants, usually as a collaborative, right? We apply for a collaborative grant. When we get that grant, that money is then sent out to all the different agencies, right? Usually a combination of private and public, and then we use that grant again to do the coordinating work. We also get that chunk of funds, right, through certificates and records and through the Board of Supervisors. We call those general funds. Those funds are also funneled to a lot of these folks who are putting together innovative practices or coming to us with a proposal. One of the other things we launched this year with our funding is what we call an innovation fund or an innovation pot, where we're putting out a call for folks in our community who have an idea, who have a creative, interesting idea, and that they can access that pool of money. So, some of our projects, to give you even a little bit more concrete. So we run 2 high-risk multidisciplinary teams in our county that are facilitated through my office. One is for human trafficking, and one is for domestic violence. So that would be an example of strengthening systems and building partnerships. One of our kind of highlight grants and programs currently is the Domestic Violence Homicide Prevention Initiative. This is an OVW, originally an OVW grant. And so we're in phase 3 of this currently with the lethality assessment program. Some other examples: we have a whole trauma-informed healthy workplace initiative where we go out to various agencies, including our own, Employment and Human Services, and help folks understand and actually do some technical assistance about what does it actually mean to be trauma-informed, and particularly support the staff who are the caregivers. We run a Train the Trainer program so we can help other people become experienced in training on human trafficking, domestic violence, sexual assault. One of our other kind of flagship programs that started right at the beginning is Domestic Violence Court, so helping create a separate court for domestic violence, and then helping with the facilitation of that court. So a concrete example here of strengthening systems is we run a monthly domestic violence court meeting where we are bringing together the district attorney who's in there most of the time, the public defender who's in there most of the time, the judge, and the probation officer to make sure that we're all on the same page about what's working well, what's not working well, and how we want to change things. And then another example is a human trafficking coalition. I'm sure many of you have a human trafficking coalition or some version of a coalition in your county, and we also facilitate that. And this is not an exhaustive list. This is just some clear examples of some of the things we do. Okay, so that was a lot. That was long. I'm aware that I'm running long, which I usually do, so I'll pick it up because Lisa's going to cover a lot of this. So the real right, meat of this is, okay, great, you're this office. How are you addressing multiple forms of violence? Well, that's why Lisa and I are doing this together. So when one of the first times that I'm going to actually skip to the slide. One of the first initiatives that my office started with was something called Families Thrive. And the Families Thrive initiative was essentially that we need to go out and provide support and trainings and technical assistance to agencies to help them understand what it's like for children who are exposed to domestic violence and give them tools and resources for working with children who are exposed to domestic violence. So through that initiative, a lot of my staff and coworkers were going out, they were talking to different agencies and resources. They were saying, hey, we're here to give this training. Here's a tool on children exposed to domestic violence. And the agencies were saying, cool, that's great, thank you. And what about children exposed to community violence? What about children exposed to gun violence or gang violence or sexual violence or, right? And the list went on and on and on. And it was essentially through this initiative that our staff started coming back and going, okay, we can't really just focus on children exposed to domestic violence because that doesn't happen in a vacuum. And so it was mostly through feedback through all those agencies that we originally said, we got to do something else, and we got to broaden our lens in terms of how we think about prevention. One of the things that I also mentioned at the beginning was one of the other frustrations that was happening around the same time was lack of concrete or measurable results. So that group of core project team members were meeting and saying, we don't have any hard evidence or data to help us know if some of the initiatives that we're putting forward are working, right? Especially the prevention initiatives. We don't know whether they're working or not. So there was a lot of building frustration around that. Shortly thereafter, I know Lisa's actually going to talk about this article, so I'm not going to spend a lot of time on it, but this article came out through the CDC and Prevention Institute. That was the article specifically on connecting the dots between multiple forms of violence. Okay, so that came out, generated a lot of conversation in our regional area, I think across the nation as well, just around how we are looking at violence generally and how we should be connecting the dots a little bit more. And then the last thing on here is timing, right? Oh, it's always got to be timing. The timing has to be right. So about a year or two ago is when public health started to become a little bit more interested, right, in being a part of the table. In our county, the Office of Reentry was developed, which was brand new. So there was a lot more momentum all of a sudden that happened around that. It felt like the time was right to essentially sit down and figure out how are we going to address multiple forms of violence, which is when we reached out to the Prevention Institute, and Lisa will talk far more about what they do, and said, hey, I think the time is right to start to bring together the folks that we already have at the table because of the nature of our office to start to think about prevention, right? So I'm just going to go over this really quickly. So at that time, essentially the prevention blueprint was decided upon as the way to move forward. So what is that? Well, it's a guide to promote safety, essentially. Safety, reduce interpersonal violence, and create a unified direction, right, for stakeholders. The really important things around this quote-unquote blueprint to prevent violence were things like creating a shared vision. That was really important, and I think that was a clear question we had at the beginning, right? Is how do you even create a shared vision? Well, in some ways, the Alliance already has this shared vision. The prevention blueprint is a way for us to really narrow in on that shared vision, right? Because we're all sitting down at the table and agreeing upon what is the shared vision, what are the shared goals. The other thing that the developing of this blueprint does is help increase the readiness and capacity of agencies, right? Because if you have someone at your agency that's showing up on the work group, and I'll get into that in a second, to talk about blueprint, they're naturally going back to their agency and talking about this stuff. So it increases the readiness once the blueprint is actually ready for those agencies to jump in. It also does things like share language, right, which we often have trouble with. People are talking about the same thing in very different ways. So I'm going to go over this really quickly. Lisa's going to do a deep dive on this. Why is it important to have a prevention blueprint? What does that mean? Well, we know that cities with greater coordination across sectors, right, have lower rates of violence. We already talked about shared understanding and multi-sector buy-in, which also was a question we had at the beginning, right? How do you create multi-sector buy-in? Well, you get all these lead folks from different agencies to come to the table and agree upon goals, values, vision, right? And then help articulate to them why it's really important for their agency to be there. All right, so I'm going to actually skip over that because Lisa will do a deep dive into that. Talk a little bit about how the blueprint's developed. So within Contra Costa County, we have 2 different groups that are going to help to develop this blueprint. The first group is called the work group. So this is the group that's going to be meeting a little bit more consistently. It's chaired by my office and public health. And this group is really kind of the workhorse, right? They're the ones who are going to be having the hard conversations. They're the ones that are really going to be defining the shared goals and values around this. And then the second group here is the group of advisors. So this is the group of folks that probably don't have the time or capacity to actually commit to being a part of a work group, but that we need their buy-in, right? Like we have to have their buy-in in order for a prevention blueprint to be successful. So these are oftentimes heads of departments, essentially, that don't have the time to sit on the work group, but we need them to review the blueprint, give feedback, and tell us what they think before we are to roll this out. So what is the work group actually going to do? They're going to sit down and answer these questions. We're in the process of recruiting the work group currently. So some of the questions, once the work group gets together, some of the questions that the work group are going to answer are, what are the structural and underlying factors that contribute to violence? Right? These are huge questions. What are the impacts on individuals, families, neighborhoods, and the entire county? What are the community and cultural strengths? And what are the existing strategies that we can enhance, right? And what are new strategies that can be implemented? Okay, so these are big questions. I think sometimes folks look at these and they're like, these are vague questions. I think that's intentional so that folks can show up to the table and start to have these deeper conversations around what this looks like. So the answers to these questions, which will take multiple months and meetings to flesh out with this work group, will eventually get rolled up into a blueprint. And again, Lisa's going to show you some clear examples of other regions and agencies that have developed blueprints, so you'll have a concrete understanding of what that looks like. So we already talked about this a little bit. What does the work group do? They're there to provide insight, leadership, stewardship, serve as an ambassador and a champion, right? Get other folks excited about the idea of a blueprint, and then really provide input and feedback, as well as the blueprint group of advisors. The other thing that's really important, I think, with the work group, because you have folks from all different kinds of agencies, is it also allows for fostering accountability between agencies, right? And the Alliance has seen this with other initiatives that we've tried to roll out. I'll give you a clear example of this. We have a commercially sexually exploited youth protocol countywide that we rolled out. And the whole point of that protocol was, okay, here's the countywide protocol now. We need you to go back to your agency and figure out your own internal protocol for working with youth who have been exploited. And some agencies did that, some other agencies didn't. And because we had a work group specifically around that protocol, we could go back to probation and say, hey, probation, you participated in that work group. Here's some of the other agencies and the work that they've done. I'm here to help you and provide technical assistance and support to getting that protocol up. We're able to use that as a leveraging tool to hold each other accountable, right? And in a way that provides support, right? Not in a punitive way, in a way that's like, hey, I'm here to help. So in terms of where we are currently, I think I told you we're in the process of recruiting work group members. We're pretty close to being fully done with that process. We've set our first work group meeting. So we've finished that. Our work group will begin meeting September, actually. Our first meeting is next month. The in-depth planning process is going to happen September through February, mostly through the work group. Then the hope is that the launch of the blueprint, right, will be in spring 2019. And the whole idea behind that launch is to make a big celebration and an event out of that, right? To continue to get buy-in and gain excitement. And then, of course, attached to this at some point will be evaluation, because that's really important. We want to evaluate, and Lisa will talk about this in some of the other projects that Prevention Institute has led, is the importance of that evaluation component, right? So that we have clear, measurable results that we can show to people and say, this is what worked. Okay, that's the long version of mine. I think I'll just turn it to you, and then we'll do questions at the end, yeah? Great. Great, so we'll take some questions now before Lisa jumps into hers. Yeah. Give you the mic.
You said early on that Contra Costa County was a pilot. So when the funding stream became more mainstream, did it expand to other counties in California, or it's just still in Contra Costa County?
So my understanding at this point is it's just still in Contra Costa County. But if you're a county in California, you have access to this. So that's an important question. Mm-hmm. Yeah, other counties have done similar things, but not through the same legislation. Yeah.
I'm back on my job now.
Kind of a fundamental question. Can you
speak to the number of staff you have and that resource?
Yes, we're small but mighty. So at full capacity, there's 6 of us. We also have some contractors and consultants that we work with very specifically on projects. So to give you a clear example of that, Prevention Institute and Lisa are a consultant with the Alliance, so we hired them to help us do the Blueprint project. Yeah, we're tiny.
For those of us that are in California, are you able to provide technical assistance?
Definitely.
Oh, awesome.
Yes, so my contact information's up here, so yeah, please reach out to me.
I was trying to clarify when you said you have access to it. Is that what you mean, you provide technical assistance to counties that are interested in this?
Correct.
What's the other part of access? Anything else?
Sorry, and clarify for me when I said that.
Because you were saying something about how California counties have access to this.
Correct. So if you are a county in California, that legislation still stands. And that legislation says that any county can essentially opt in to this program. And there's some paperwork and rigmarole that goes with that. But that's what we can provide technical assistance with to get access to funding like this. And again, that's specifically tied to marriage, birth, and death certificates. And then we've had to work to get other streams of funding. Yeah, thank you for that clarification. Yeah.
So presumably because you're here telling the rest of us who are not in California about this, you're willing to provide technical assistance to the rest of us?
Yes, not in California. Absolutely. Yeah, and that's actually one of the things that myself and my supervisor, Devora, have done is consulted with other counties. Even if you're not in California, if you're interested in pursuing something like this, we can sit down and walk through kind of what the legislative process was, like how to find your legislator that's going to be really supportive to this, and then how to present the information in terms of like, okay, great, here's the bill you need to put forward, and here's the people we need to create buy-in with. So yes, absolutely. Yeah.
What were the hard parts?
Oh gosh. Of what? The entire office or the blueprint specifically? Yeah. I mean, we're still finding a lot of surprises. I think that's part of the nature of collaborative work, right, as you're continually moving. I think one of the things that in hindsight we probably should have anticipated, but I think continues to be a challenge for us, is it is incredibly frustrating how leadership driven a lot of our work is. So when I showed that picture of the core project team, which, yeah, many folks are laughing because I'm sure you all know this, right? Depending on who we have at the head of various departments, the district attorney's office is a great example of this, right? So for a long time, we had a district attorney who wasn't super sympathetic to a lot of the issues that we had. It was really hard to get buy-in from them. There were folks under that district attorney, deputy district attorneys who were super invested. It was really hard to get continual movement. We've actually just recently had a shift in our district attorney. Now all of a sudden they're at the table, they're throwing money, they're, you know. So I think that's one of the things that we didn't anticipate. We knew that, I think, in our gut, but we didn't anticipate how big of an issue that it was going to be. Yeah. Great. Yeah.
I have a question for folks. What resonated the most about the story that Alex told? Like, what is something that you got excited about and think might be something that you would want to bring back to your community to try out? I'd love to hear from a few folks.
I'm just super amazed that you had people who said, hey, this should be a government project or institution or whatever, term you want to use. I find that in my community, it's the opposite, that it's like, oh, let's keep this out of government hands. Let's make this a community, maybe a nonprofit, but any kind of collaborative. It should be led by non-government people.
And, oh, do you want to comment? No, go ahead. I just wanted to comment that just knowing Contra Costa's story a little bit, it's very much a both and. It's really, there's a commitment to government's role and there's a commitment to non-government role. And I think both sides are really see the value of, what can be achieved in through different sectors.
Quickly to that as well. I think it's really important to have an office like this within your local government. I would also say addressing potholes. It's also really challenging because most of us, right, I would say most of our staff has come from a nonprofit background. And so we're now operating deep in the bureaucracy. And that's really hard. Things move really slow. Also because, as I've articulated, we're a convener of multiple agencies, oftentimes multiple agencies that are stereotypically opposed, right? So district attorney and public defender are a great example of that. We have to remain neutral on a lot of things, right? We have to hold space in a way that's gonna allow everyone to show up fully with whatever they're showing up with. And I think that's one of our biggest strengths, and I would say personally can be really challenging too. Yeah.
I work in Alpine County, which is like this 1,500 population county, and I just started working there, and I've been told so much about how much there's so much collaboration that goes on, so it'd be really exciting to get kind of like an official sort of collaboration thing, so it's nice to know that it's successful on like a much bigger scale. We can do that in our 1,500 person county.
Definitely.
So
Yeah.
Well, I think one of the things that kind of stood out for me is the funding source that you came. The center that I'm with, we were also designated the Governor's Office on Bullying Prevention 2015, and we are still looking for the first dollar to come from the Governor's Office. Kind of the joke is every year that it doesn't happen, the logo is going to become more like a watermark, kind of fade further and further away. But the use of that is kind of intriguing.
Because the process is so complicated, what's impressive to me is the number of products or protocols you've developed. And all of those are areas that the county that I'm in, which is right next door to yours, didn't know you were there, and they're all struggling to create all of those things.
Yeah, use us. Call me.
I'd love to see a job description for who you hire because you were talking about maintaining a neutral space and to have someone talented enough to facilitate that. I mean, kudos to you guys for doing this work. That's particularly hard.
Yeah, so just to respond to that, one of the issues here is we're a government agency, so our job descriptions are government county classifications. So anybody who knows, right, the government world, like there's very strict classifications. So our job description is the most general, generic, boring job description that's attached to a classification. So we do a lot of workarounds to find the right people, and then we do a ton of training on facilitation, intergroup dialogue, ton of stuff on restorative justice, and really like being comfortable in uncomfortable spaces, essentially. Yeah.
Oh, I can get there. It just takes a second.
Thanks. I'm from Georgia, Atlanta, and work for public health. And this is something that I am trying to get started. One of the problems we have, like a lot of states, I'm sure, is that they're around the metro areas, there's lots and lots and lots of stuff. And then you get below a certain point and there's nothing. Yeah. And one of the things our health departments are saying to us is, well, it's not that they don't have the problem, they're not going to talk about it. They're not going to talk about it. We don't, we just can't do it. I don't believe that. I think once you frame it in a way that people don't feel threatened necessarily, that they will be willing to join in. And so I was really interested in the idea of how you got that buy-in, because I'm looking to have non-traditional partners. And the leaders, the unofficial leaders in the community who really know what's going on. And I think really for us, the best idea is to keep pushing the message that violence is a public health issue. We sort of kind of talk about it, but we don't lay it out there every time we do something. And I think it's important because it is. Yes. And it's in every community. Yep. So I love the idea of this. I am one person, but I have a whole lot of people who would be interested in doing something like this.
Yes, that's wonderful. Yeah, thank you for sharing that. Public health has a huge role to play in this. Yeah. Great. Oh, one more.
Right in front of me.
Just super random, have y'all considered maybe creating like a toolkit of how to achieve this, or have you done that?
Yes, we have considered that. It's mostly just a capacity issue, but yes, and that's one of the things actually. So I've just transitioned into the manager position of this office. So one of the things that I'm excited about going into is really kind of tidying up a lot of our projects, tying them clearly to strategies, and then putting out some stuff like toolkits, really clear brochures, really clear information on our website about how to get technical assistance if you're interested. Yeah, thanks for asking. Great. Okay.
Well, let's give Alex a round of applause. It's really great just to hear the story. I knew bits and pieces of that story, but I learned a lot too. And I think we all learn from hearing each other's stories. So I want to kind of continue in that vein, but I just want to make a couple more comments about the Contra Costa County story. I'm so glad you all got to hear it and kind of be wowed by the evolution of their work. A couple things that I'll just point out. One is, as Alex mentioned, it started out with the local domestic violence agency saying, we need a coordinating body, we need policy change. So that was the impetus for creating that funding, that legislation, creating that funding stream that's been sustained to this day. So there's a really valuable lesson there, and just taking leadership in policy change and advocating for what's needed. Also, just want to acknowledge what humble rock stars you all are. Contra Costa County is like, not everyone knows about it. It's not San Francisco County. It's not some of the more well-known counties, but you all have plugged away at this work for many, many years. And I have to give a shout out to Devorah Levine, who is just one of these people who, hi Devorah, if you're listening to this in the future. So she is a complex thinker who just plugs away and continues to plug away and believes in what she's doing. So just want to give props and shout out to all of that. Also very interesting, does anybody know this person named David Lee? You've heard of him? Okay, yeah. So David used to work for Devorah in Contra Costa County. And Devorah came from the local domestic violence agency, and now she's moved up into the county government system. So just a little bit of background and hopefully some inspiration. And I want to continue with that kind of word of encouragement, because you all asked some really challenging questions, and there aren't simple answers, but I do think that just this notion that people like you in your communities asking those questions and trying to figure it out is how progress is made. There will always be challenges, there will always be setbacks, but it's, folks, caring community members like yourselves who know that this is important, who know that what is possible, and just to continue to plug away at it. And sometimes progress does feel really slow, and I can attest to that from Prevention Institute's experience as well. But there's no doubt that it's by coming together and working together in this kind of approach that we will have success both short-term and long-term. And the funny story about that for Prevention Institute is that when we were founded, we were talking about connecting the dots between multiple forms of violence from the get-go over 20 years ago. And one of the very first strategic plans we helped to develop in Salinas, the city of Salinas. Anybody here from Salinas? Oh, Cultivating Peace in Salinas, 20 years old, really looked at how do you cultivate peace across multiple forms of violence. And so, and then the Connecting the Dots document that literally took 8 years to publish. Yeah, so things take time, but progress is possible. Okay, so I actually wanted to address a couple of the questions that you all raised, and then I'll go into my slides. And on the note of who's in the room and story sharing, anybody here from Colorado? Oh, Danielle, okay, you can come up when I show your slides. Anybody here from North Carolina? Great, you can come up and talk about your work as well. Anybody here from Milwaukee, Wisconsin? That'd be wild. I mean, just because I would probably recognize you. Okay, and there are probably a couple other communities that we highlight in here, so
just want to acknowledge that, and hopefully you'll be able to share your own work directly. But we love to share stories. Okay, so a couple of questions. How to incentivize the work and create buy-in. I'll definitely talk about this a little bit more in detail. But, you know, that is such a good question. Well, first I'll just say, and I'd love to hear from all of you as well. Like, does anybody have ideas about that? How do you incentivize the work? Obviously, there's a lot of things that can become barriers to collaborating across multiple forms of violence, but anything that's been successful in creating incentives to collaborate? I'm looking at you, Danielle. No? Okay. Well, okay, go ahead. Yeah.
Wait for me.
Okay. Again, I think it's so valuable to hear from practice, so let's hear from folks.
One clear incentive is public recognition.
Public recognition.
So to throw parties and honor people, give them awards.
Okay.
And it can, in a way, it can commend them for what they did do, but it also pushes them to do more. But
Yes.
it also gets other people thinking about that they'd like to be up there too.
Yes, and that's what I was going to say, that tap into the fact that people care and want to have a positive impact. No one wants to spend their career feeling ineffective, I don't think. So tap into that fact that people actually care and want to have an impact, and probably want to get over the same kind of frustrations that you're having to be able to achieve something together. So, and then recognizing that and applauding that, and yeah, I think that's a really fundamental piece.
I think for us, we've been able to manage a human trafficking coalition for 15 years, and one of the biggest ways to keep people engaged is input and access. So allowing the space for individuals to provide input around development of interdisciplinary, multidisciplinary protocols, and then access to tools, to protocols, to trainings. That's usually something that a lot of communities do not have access to. So providing that input, opportunity, and access has, for us, has allowed us to keep our coalition for this long.
Great.
And I've done some work on this too,
Yes,
even with
please.
Lisa. And I would say,
Emily.
I'm taking, as I walk over here, I would say working on something together, like having something that you're doing together is really important.
Thank you. Food is always good to bring, just as like a concrete
It's a fundamental
thing.
need.
But also being really intentional about highlighting the intersections of your work.
Yeah.
And allowing people space at the table to talk about those things. I know one of my peers in Virginia has been really great about highlighting the ACEs and how they are so interconnected to all the different offices that are a part of this work. So
great. And
I don't know if that's applicable.
I think it's pretty similar to what you were just saying. I remember years ago just learning to get my health officer involved in something, and somebody said to me, talk to him about how this will make the work he's doing successful. And I think that intersection piece was so critical, because it's really our job, and of course Lisa does a great job of this, of when we're looking at those connections, to make it really clear if I'm going to bring in that partner, that I really learn from them what their goals and objectives are and what they really hope to achieve. And then it's my job to say, well, here's how we're in alignment. And here's something that if we do this together, this will help you achieve your objectives.
We talk about win-wins or co-benefits. Ways that, I gain something, you gain something, we both gain something.
Yeah, kind of piggybacking off of that idea in terms of collaboration, instead of, I have this goal that I want to achieve and you could be a part of that. It's also reaching out and asking, what do you want to achieve also? And I can help you. It's not just about you helping me. Right. It's a give and take also.
Yeah.
And also in terms of what you could do to incentivize is giving people roles, because I feel like when you put the you're a chair of this work group. You're not just a part of the work group. Makes people feel important.
Great. Okay, we'll take one more comment, and then we'll go into the next question.
It's really just another detail of what is being said, but agencies that are not always looked at well can look much better to communities when they come together in multidisciplinary team initiatives, such as law enforcement coming really together with advocacy for victims of crimes makes them a lot more legit to the communities. So those are really great values.
Thank you. Okay, well, that was the how to incentivize. So for the person who asked that, I hope, was that helpful? Yay! Okay, good. Okay, I think actually a lot of these other ones we can touch on if I remember as we move through the presentation. And Alex, can you let me know when it's like 22 or quarter to? Or actually, there's probably a, okay, perfect. Because, wait a second, I'm sorry, we go to 5. Okay, perfect. Okay, so this first slide, I'm going to take a step back and just talk a little bit about kind of why the approach. I'm going to go through this fairly quickly. A lot of this is summarizing the content that's in the Connecting the Dots document. And that document, again, really tried to, we tried to create a tool that would be very useful, practical, and giving the kind of summary statements that so that you all could make the case for a Connecting the Dots approach. Can I see a show of hands of folks who have used that document, Connecting the Dots? Oh, that's so great to see. So, again, when I look at this slide, I feel like it simplifies a lot of complexity and a lot of nuances, but the point is, it's helpful to be able to kind of do a little bit of a synthesis to help make the connections for people to be able to think in a more integrated way. So that's what I'll say about that slide. This quote that we use at Prevention Institute a lot really emphasizes the need for a Connecting the Dots approach, that we are all shaped by our social, cultural, and physical environments. And so these different forms of, manifestations of violence and abuse are so largely shaped at the environmental level. And so if we want change on multiple issues, we need to take that step back and look at the bigger picture of how things are connected. And this is a quote from Dr. Deborah Prothero-Strith, who's now at the Drew College of Medicine, who really just, articulates what we know, which is that these different forms of violence and abuse are all connected, and yet we operate in silos. We've created silos, and we've got to break them down. And then, part of the benefit is that when we recognize the shared and compounding impact of multiple forms of violence, then we can build a shared agenda. We can demonstrate that investing in violence prevention can have an impact across several issues, and we can advocate for coherent strategies that have powerful outcomes. And that's a statement from a new piece that we published in 2017 called From a Cycle of Violence to a Culture of Safety. So some of what I'm going to share today comes from that piece. And the work is really grounded in this 2014 document that we mentioned. Are folks familiar with CDC's strategic direction that came out of that, and the technical packages that look at the research on effective strategies across different forms of violence, and then, from there we can look at strategies across different forms of violence. Okay, so that brings me to the 5 connections between multiple forms of violence. These are the 5 connections that we explore in the piece that we published last year. So first, that multiple forms of violence are shaped by common structural factors, such as sexism and racism, resulting in inequities in rates of violence. It's really, acknowledging that the shared roots of multiple forms of violence and abuse. Number 2, common underlying factors influence the likelihood of multiple forms of violence. So not only are these different forms of violence shaped by these real structural drivers, but at the community level, there are, or even at the interpersonal level, there are factors that are common across different forms of violence. Number 3, different forms of violence have common harmful impacts on individuals, families, and communities. And there was a person who talked about sort of people coming in for support around different types of violence, and in some ways there are real, genuine, distinctions between the impact of different types of violence, and it's really important to acknowledge that and be able to attend to that. And obviously individuals are different, communities are different, so we're always needing to address the nuances and the distinctions in people's experiences, and we can also point to what's the common harmful impacts. The impact of trauma, the resulting impact to mental health and other conditions. Number 4, exposure to one forms of violence increases risk and further victimization and engagement in violent behavior. This is another connection. And then 5th, that multiple forms of violence are often experienced together in families and communities. So this is kind of summarizing what we know or what the research says. And then what are the implications then? So the implications of what I just shared are that there are 5 things that we can focus on to prevent multiple forms of violence, and I'm going to go through each of these. The first is to integrate equity policies and practices throughout. The second is to build a shared understanding from data, including and especially through lived experience. Number 3 is to address shared risk and resilience factors with an emphasis on promoting community resilience. Number 4 is to build and operationalize a shared agenda. And number 5 is to build in a life course perspective and focus on positive early childhood development. So these are some of the conclusions or lessons that we are drawing from folks who are trying to move from the sort of theory research, into practice. So I'm going to go through each one of these with some examples and hopefully hear from all of you as well. So number 1, integrate equity policies and practices throughout. So one example of that is work in Milwaukee, the city of Milwaukee. The city of Milwaukee undertook a planning process to develop a blueprint for peace. And similar to Contra Costa County, they went in with an understanding that they wanted to address multiple forms of violence: community violence, sexual violence, domestic violence, child abuse, suicide. What else, Alicia? Alicia from Prevention Institute was a consultant on that project. Might be missing a couple, but you get the idea. But what was really important in that from the beginning was the commitment to acknowledge that structural factors generate inequities and rates of violence. So really naming racism, sexism, and other systemic forms of inequality at the root of multiple forms of violence was really important. The planning process emphasized equity as a principle for prevention, and because that was named from the get-go and included throughout the process, the result was that the understanding that was built included that understanding, and the strategies that were selected addressed that understanding. So the plan includes strategies like community building, community healing, restorative justice, training to address implicit bias, and a variety of community engagement strategies that really are aimed at shifting power and making power more equitable in the city of Milwaukee. So I just want to take a pause there to hear from folks to see if you've tried this kind of approach or what your reaction is then. Especially, I think there was a gentleman who talked about fostering collaboration with different amounts of political power. That's the reality of our communities. There's inequity. There's vast inequities in political power and other types of power in our communities, and that's what that's a big piece of what we're trying to address. So we need to be able to name that and be skillful in addressing that. So can I see a show of hands of folks who equity, and naming these forms of oppression and a commitment to equity is a part of how you look at violence and multiple forms of violence? Just see a show of hands. It's a good number of folks. So we have found that it's really fundamental and really important and very powerful in shaping the entire process. Any questions or comments about that? Yeah.
I was just asking if we'll get copies of the slides.
Absolutely. That's an easy question. Any other easy questions? No. Any other comments about the equity? Yes.
So I do work in the Bureau of Health Equity, but I would like to know what you mean when you say shifting the balance of power and what that looks like in a practical sense for the community that you've targeted.
So I'll speak to Milwaukee. I mean, one of it is just acknowledging that, so factors like structural racism, structural sexism, structural economic inequity creates inequitable conditions in communities where some communities have greater access to conditions that promote safety and some have less access to that. And if we want to create safety, we have to create more equitable access to those conditions. And with that understanding, prioritizing neighborhoods that experience inequities in rates of violence, and then prioritizing the kinds of strategies that we think will help to correct that. And then also making sure that communities that are oftentimes not included in decision-making are given more access to decision-making power to shape the kinds of investments that are made. All right, well, I'm going to move on to the next one then. Number 2. In our 5 ways to prevent multiple forms of violence. Build a shared understanding from data, including and especially through lived experience. This is one of the keys that I think is so important, and folks have alluded to this, is that we have to build that shared understanding so that people are then invested in this approach. And it's really interesting. It's like a mindset, it's a way of thinking, it's a way of viewing the world in a more interconnected way. And some people have more of a natural inclination, more exposure, more support in training their mind to work in that way. Some people have less. You know, and something that Danielle shared in the last presentation that she did really was about being careful of who you bring onto your team and really looking for people who already have that understanding and then can promote that understanding in others. I find that talking to people about their lived experience is one of the best ways to get at this. There's the research and what the research says, but it's asking people what's going on in your family, in your neighborhood, in your community, in your life. Tell us about that. And people will generally not talk about, they don't talk about violence in silos, right? They don't say like over here, da-da-da-da-da, and over here, da-da-da-da-da. They talk about violence. They talk about fear. They talk about harm. They talk about who is harmed and how they're harmed, but not in this totally siloed, disconnected way that, you know, we can in our bureaucracies. So lived experience. Here's an example from Kansas. Anybody from Kansas? They did participatory community assessments. Other folks talked about other kinds of mapping and other kinds of assessments where people really get to talk about their lived experience. You can also use other types of data. Here's an example from Alameda County looking at, this is mapping poverty, this is mapping assault-related emergency department visits, this is mapping partner assault ED visits, right? You can visually see where there are greater concentrations of these overlapping risk factors for violence and forms of violence. So build your case using data, including from shared experience. Number 3, address shared risk and resilience factors with an emphasis on promoting community resilience. So once you have your commitment to equity, you've really built a shared understanding. Let's look specifically at the shared risk and resilience factors. This is where the Connecting the Dots document can be really helpful in like, oh, look, there's an X, there's 5 X's. This must mean something. A couple examples I'll run through. In East San Jose, California, they are looking at social capital, the built environment, and economic opportunity as their sort of 3 buckets of community resilience. Colorado, I so wish, well, hopefully many of you heard Danielle's talk earlier, or you can listen to the recording when it becomes available, but here are some of the protective factors that you all are focused on, I believe. And I'm going to go through that. Actually, I'm not going to go through it in detail, but there's a great resource there. Yes? Yeah.
I I'm just wondering, is there a specific reason why you're using risk and resilience factors as opposed to protective factors? I was wondering if you could speak to the difference in language there.
Yeah. I kind of use it interchangeably. Yeah, so I think resilience refers to the ability to thrive in spite of the presence of risk factors, or even in the presence of risk factors, whereas protective refers to, what helps to prevent. So generally, we tend to use the word resilience a lot, but they're the same thing. It's just a little bit of a nuance in emphasis, I think. Okay, in North Carolina, here are some of the resilience factors or protective factors that they're focused on. There's a coalition in Charlotte, North Carolina, and here are the 4 that they are focused on. So hopefully you can get a sense. So focusing on a sort of a tangible number of factors that folks can agree are shared across different forms of violence and that unify the work. Here's Milwaukee's blueprint, where there's more than 5 factors. These are actually the risk factors grouped into the 3 clusters of people, place, and equitable opportunity. In the Contra Costa work, we are looking at human trafficking and sex trafficking, and that is something that Connecting the Dots does not address. So there's less research there. We're looking at risk factors related to child maltreatment, intimate partner violence, sexual violence, and gang violence that might be related. But this is an area where I think more work is needed, and both, again, what is linked and what is distinct, what is shared, what is distinctive really needs to be teased out. Okay, so you've committed to equity, you've built a shared understanding, you're looking at shared risk and resilience factors, and now it's time to build and operationalize a shared agenda. Now, how do you do that? And there's Colorado again. So again, I wish Danielle could speak more to this, but here's, it is possible to create these kinds of strategic plans that help to operationalize a shared agenda with different types of partners. I think someone asked the question, how do you agree on what to work on? How do you develop those shared goals and vision? And I think naming a set of criteria by which you're going to make decisions is really helpful. And agreeing on what those criteria should be. So here's some examples of criteria from Colorado. Here's a way that they're operationalizing that through braiding, work, and funding. And here's a strategy by which they're braiding funding to implement a shared approach. In North Carolina, they focused on 2 goals. And here are the decision-making criteria that they used to arrive at those goals. So let me take a pause here. How many folks are familiar with sort of in strategic planning coming up with a set of criteria by which to make decisions? Just let's see a show of hands. Are there any kinds of criteria that you have found helpful in being able to build this kind of a shared agenda or operationalize a shared agenda? Anyone? Okay, so I think, like looking at what has the potential for high impact, what is something that's changeable, which is another way of putting that. Some of the other criteria that we have looked at are where is there existing political will, resource, let's see what else, urgency. Yes, Emily.
And I've worked with some collaborations where we've made decisions about how we're going to handle whether we all need to agree or whether we can move forward with what type of agreement.
Yeah, I agree. And yeah, so I would definitely describe this as an art and a science, or maybe more art than science, because I mean, there's definitely some rational thinking that you can bring to it, and then there's the community context, and there's the process, and there's the people involved, and how you are able to just make decisions and move forward together so you don't get stuck in getting something perfect, right? And so, and here's where I think that power differential issue comes at play as well, because who's at the table making the decisions is really important. And so we are very careful in creating planning groups that include the types of folks that can help to mitigate some of those power differentials, and also really careful in including as much community voice in the process so that it's not a narrow group of people who hold a lot of political power just making the decisions. So those are some of the things to be able to pay attention to. But if you can agree on some criteria and you can go through an imperfect process of assessing potential goals, potential strategies according to that criteria, and come to an agreement, and then you go. Okay, and this is the goals that were developed for Milwaukee's Blueprint for Peace. And again, it's an imperfect process. Does everyone who's involved in this, you know, agree wholeheartedly on every single word included in the blueprint? No. But it's a constant kind of community organizing process of getting more and more people to be on board and willing to collaborate and cooperate. And then the last thing that I'll share is this notion of building in a life course perspective and focusing on positive early childhood development. That's definitely grounded in research and science. Early childhood is a developmentally significant and sensitive period, and if we can build in protective factors for young children, we can help to prevent multiple forms of violence. So there's definitely science behind that. And then, of course, you know, it's not just about the young kids, it's about the life course perspective, but it's really helpful to hold both the focus on the early childhood and the developmental trajectory over the course of the lifespan. How many folks have found this to be true in your work, that folks can come to agreement around a focus on early childhood or a recognition of the sensitive time period? Yes, I'm seeing a lot of nods. Yeah, folks raising their hands. So again, something that's both grounded in science and, you know, something that's politically perhaps more easy to get people to come behind. So this is North Carolina's work, where I think they developed a plan that looked at some shared goals across multiple forms of violence, and then when they did their update in 2012, they made a decision to look at early childhood and child maltreatment prevention as a cross-cutting issue for that plan. So those are the 5 ways to prevent multiple forms of violence, and a few stories from some of the communities that we've worked with on how they are in their communities developing and implementing these plans and addressing multiple forms of violence and abuse in the process. So I'm going to look at our questions again. The issue of funders, getting funders to be more flexible. Any funders in the room? Not going to make eye contact with anybody or put anybody on the spot. Oh, look, there's funders in the room. Okay, so I'm going to turn it to the two of you for some final words, or a couple of words in our last 5 minutes. I think this is so important, and so much of this is legislated or influenced by the folks who are making funding decisions. So let's hear from them on how, you know, what they found to be effective, and then let's all continue to do our work of trying to influence our own funders.
I can only speak from our perspective with the California Department of Public Health, and I will say that we had our director get very involved in thinking about violence from this larger perspective, and she created a violence prevention initiative. And as part of that process, we're looking across the department in terms of where are all the places where violence could be construed as an impact, and how can we address that through there. And so we're starting to look at place-based initiatives and social determinants of health and adverse childhood experiences, and we're hoping to create a model that we can use with local health departments to also be able to braid and blend some of those programs. I will point to an initiative, Accountable Communities for Health, that's happening in California, and one of the most positive aspects of that is communities developing a wellness fund, where then you could have different projects contribute some funding into this fund to address some of these more overarching, hopefully health promotion types of things?
Thank you. I'll say from our experience, funders want to be effective too. So, a lot of it is taking the time to build shared understanding with your funders, and then, convincing them of your capacity to do good work, and to do good work with other people. And then, again, funders want to be effective, and to the extent that they can be flexible. Where am I headed? There was a funder over here.
She has a question.
Oh, okay. Was there another funder who wanted to? Oh, yeah.
So I'll just say, I think, kind of tying off that, I don't think we want to reduce the burdens for local communities to be able to collaborate through our funding. And I think one way that we've been trying to, I'm at the health department in Colorado with our sexual violence program. And I think one of the ways we've seen progress around this is actually through this risk and protective factor framework. So I think increasingly we as funders and those in my office are predominantly focusing RFAs and funding opportunities based off of risk and protection versus entirely on our outcomes of interest. And so there's a lot more latitude to say oh, this is for economic stability, so is mine. We're working on different outcomes, but where's the potential to integrate? So I think as funders, we're trying to challenge ourselves to think a little bit more about how do we make sure that we allow folks to collaborate, and for us as funders, who is most flexible in their funding that can help us do that as well.
One last question?
No, we're passing on the question. Another question?
Oh, okay.
Here we go, back here.
So we have, oh yeah, go ahead. What?
I mean, if you're out of time, I don't want to.
Okay.
It goes back to the question of equity and bringing people to the table that are the most vulnerable, because at least in our community, we're in the South. There's a lot of racial inequity. There's a lot of long-term intergenerational trauma that has led to a mistrust of service agencies and the government. So getting those people to the table in the first place, much less having the time and the will and the energy to participate, is a gigantic challenge, especially because they're who we want to serve. But if we can't close the gap on that communication, then we're not able to get a good assessment of what's happening at the ground level in those communities. And they don't necessarily want us coming in saying we've got answers for you at all without their input. So we're at a bit of an impasse, and I'm just curious, as you were bringing up equity as one of the key things, one of the first things that needs to happen for prevention to take root, I'm curious how you might overcome something like that or anything along those lines.
Okay, well, we're at time,
That's
so
all.
we're going to need to close the conversation, but I'd be happy to chat with you before. But I think it is the way. That is what we do. We collaborate, we figure out how to share, we figure out how to make the circle bigger, the table bigger, so that we can all be more effective in what we are doing. So that's the short answer, but but thank you all so much for participating, and I hope that it was helpful and that you are leaving with ideas of things that you can take back to your community. So thank you.
Thank you for listening to this Prevent Connect podcast. Prevent Connect is a project of the California Coalition Against Sexual Assault, with funding from the Centers for Disease Control and Prevention. The views presented on Prevent Connect are not necessarily the views of the United States government, the CDC, or CalCASA. To learn more about Prevent Connect, visit www.preventconnect.org. For more information about CalCASA's mission, or to show your support, visit calcasa.org. That's CalCasa.org.